Hello, I'm Dr. David Millar. I'm a GP that works in NHS Lothian, and today we're going to be talking about norovirus. Norovirus is a common virus that affects the stomach and intestines, so let's talk about exactly what norovirus is, how it spreads, what we can do to manage the symptoms, and when you need to seek further medical advice. It can cause vomiting, diarrhoea, abdominal cramps, and sometimes mild headache, fever and body aches. It's something that's very easily spread, so it can cause outbreaks of vomiting and diarrhoea in settings such as schools, care homes, hospitals and cruise ships. It's something that can usually be managed well at home, and although it's an unpleasant thing to have, it usually will pass within a couple of days. People can get norovirus more than once. The virus is always changing, so you can get norovirus multiple times because the body can't form any long-term immunity towards it. As I say, it is a very highly infectious virus, so to prevent the spread, it's important if you have symptoms to stay at home and not go back to school or work for at least 48 hours after the symptoms have settled. Wash your hands regularly, especially after going to the toilet or preparing food. Ideally, this is with liquid soap and warm water. Cleaning contaminated surfaces with a bleach-based product is important. It's also important to wash towels, bedding, contaminated clothing separately from other items too. Symptoms can usually be managed at home, and symptoms will usually settle within 2 to 3 days. So ways of managing the symptoms are staying well hydrated, drinking plenty of fluids is very important, rest to allow the body to recover, paracetamol to treat symptoms such as fever or muscle aches or abdominal pains, stay off work or school for at least 48 hours until the symptoms have settled. So you should seek medical advice if you are unable to keep any fluids down at all, if you're showing signs of dehydration, if you have severe abdominal pain, or if your symptoms are going on longer than 2 to 3 days. Babies and young children, especially babies less than 6 months old, or very elderly, frail patients are more at risk of complications from norovirus. So when looking after children or elderly vulnerable people, it's important to have a lower threshold to get in touch for medical advice. For further information, visit nhsinform.scot.